Hi, guys, it's Dr. Sadaf, and I just wanted to give you an update as to what is going on. So, I have opened up my practice in Chappaqua, New York, and I'm currently accepting new patients. So, I want to invite you to come and become a patient of mine. If you've been listening to this podcast, you've been listening to the episodes, you are finding so much value in all of this. I want to invite you to become a patient of mine and come see the difference with a doctor that actually has time to listen to you and support you through the transitions that you may be experiencing, whether they're perimenopause, menopause, or you're experiencing any type of sexual dysfunction. And of course, I do annual GYN exams as well. So if you're not having any problems at all and you just need a regular exam done, I am more than happy to help you out. So make sure you check out the practice. It's called FemV Health, and the website for that is www.femvhealth.com. And make sure you look that up. The phone number for the practice is 914-538-2534. And make sure that you go and check it out. Check out the website and make sure you book your appointment today. Also, I have just started a new Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, FemV Health. And I'd love for you to come and join that Facebook group, because in that group, we'll be talking about different ways that you can get support and education as you go through this important transition in your life. It's also about building a community that is going through the same things that you are. Oftentimes we feel that when we go through things in our life that we are the only one, but I'm here to tell you that you are not alone, and that there are so many other women going through the same symptoms that you may be going through, whether it's hot flashes, night sweats, mood swings, vaginal dryness, pain with sex, brain fog, joint pain, dry eyes, any of those things, so come join us in that Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, and that's on Facebook. So come and join us in that community, and I definitely look forward to welcoming you there. And make sure that if you have any questions about any of the podcasts that I do, that you either DM me or email me, and I will create a podcast just for you, because you are a loyal listener and subscriber, and I would love to answer any and all of your questions. So if you have any burning questions that you are wondering about, please make sure that you email me at hello@femvhealth.com and let me know about your questions, or DM me on Instagram or TikTok, and I'll create an episode just for you. And as always, make sure you like, share, and subscribe to this podcast. As you know, I am looking to get over 100,000 downloads by the end of this year, and I'd love for you to help me out in that endeavor. And so please share and like these podcasts, download them, and let all your family and friends know, because I know there is not much information out there, and some of the information out there is not actually factual. So you want to make sure that you are getting your medical information from a board certified OBGYN that knows and has studied all of this material, whether it's sexual medicine, perimenopause, or menopause. So looking forward to hearing from you. And now to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about sex therapy and visiting a sex therapist, perhaps while going through perimenopause, menopause, and kind of what that looks like. But before I get into it, I want to make a few things very clear. As always, I'm not giving any type of medical advice. If you have any questions about your health, please speak with your healthcare provider, and definitely not giving any advice about religion. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today, I'm very excited to have on with me sex therapist Nikita Fernandes. And for those people that may not know you, Nikita, we'd love for you to introduce yourself.
Thank you so much for having me on. So my name is Nikita Fernandes. I use she, her, hers pronouns, and I'm a mental health therapist and sex therapist located in New York City, where I work at a private practice. My work primarily focuses around helping people of color feel sexually empowered. As I am a person of color myself, of South Asian heritage, and I was born and raised in a city called Bangalore in India for 19 years. And so I bring a lot of my background as an Indian person and my lived experience in a collectivist culture to my work. That has also been strengthened by my specific training within the field of sex therapy. And so I am very passionate about helping people feel empowered through their sexuality and helping them recognize that um, receiving pleasure through sexuality is a very radical thing to do in a world that tries to take it away from bodies of color. And so a lot of my work is based around empowering people.
That's fantastic. Okay, great. So, I think that we talked a little bit offline that I didn't realize that you were of South Asian descent. So tell me a little bit about that. You said you grew up in India and being sex positive, I would assume that, I don't know, how was that for you? How did you come to decide that you want to be a sex therapist? And, I would assume that, well, I shouldn't assume, right? But I think that a lot of people tend to think or equate South Asian culture with a lot of perhaps sex negativity or definitely a lot of shame and taboo. And so I'm curious how you came to be a sex therapist.
That's a great question. I think from a very young age, I've always been very curious about sex. And it's interesting to have grown up in, a very different culture than the one I'm in right now, where I feel like back in India when I was younger, sex was seen as almost like this Western concept, like sex positivity is associated with the West and is even shunned in some places. And so I grew up receiving, sex education that was very structured around unwanted pregnancies, and it was a lot of like fear-based information, unfortunately. I also went to a Catholic school for 12 years, and so that played a huge role in, unfortunately, the shame that I internalized growing up in India. I do feel lucky to have had friends that I could talk about sex with. That is something that I remember in fifth grade. I started to talk about more, and my curiosity in it just kept growing and growing. And then when I was 19, I came to the US to study to be a therapist. And when I found the sex positive scene in New York City, that played a huge role in helping me feel like this is the community that I want to center my work around. Specifically, people of color and people that have immigrated here from other countries that are transitioning to a Western culture and a Western view of sexuality.
Hmm. That's fantastic. So tell me, I would say that a lot of communities that, perhaps South Asian, but they don't have to be South Asian. They could be a lot of different communities, right? I'm sure as you come across people in your own work, you realize that it's not just South Asians, but it's a lot of communities that have a lot of sex negativity and definitely view sex as perhaps just for procreation and maybe even like shameful or wrong and dirty. And so, a lot of people find it difficult to find that pleasure. I'm curious to know how you help people to that start out very sex negative to become, perhaps sex positive.
Yeah, that's a great question because this is something that I've reflected on my own journey of growing more sex positive over time. I don't think that I thankfully like internalized a lot of that sex negativity. I think I've always been very curious about um, the history that we come from in terms of pre-colonization. And so when I'm working with clients that come from South Asian backgrounds or come from specific, religious spaces like being Muslim or being Hindu, It's very important for me to talk to them about the impact of colonization on our understanding of sexuality and the conservatism that entered the country when different countries in South Asia were colonized by the West. I'm also very interested in looking at texts that were from like a long time ago that have a lot of proof of the sex positivity that was very inherent in the culture, in addition to queerness and polyamory. And I think all of that got whitewashed essentially. And unfortunately, a lot of people then started to internalize um, these notions of sex is bad, sex is only for procreation. And so I help people connect with their sexuality by helping them understand that their heritage and the line that they come from and the culture they come from was once sex positive. And by connecting with our own sense of pleasure in our body, we can reconnect with these things that have been taken away from us by colonization.
Right. I agree with you. I think colonization has played a huge impact on, different cultures throughout the world. And of course, Southeast Asia. And we see that as, like you said, we go back in history and we take a look and we see that those cultures are very sex positive until they were colonized by the British, which brought their puritanical views over to Southeast Asia. And then, we see that those cultures become definitely more conservative. I know that when I talk to people that grew up in the Middle East, actually, they are more sex positive that I have seen than even Southeast Asians. I know that specifically speaking about, like, some Muslim cultures in the Middle East, I have a lot of friends that are of Middle Eastern descent, and they are definitely, I would say, more sex positive than a lot of my Southeast Asian friends. That are not as sex positive. And I think that perhaps, I don't know. I mean, I know that, the Middle East, of course, was also colonized by Western Europe, but somehow they, were able to still hold on to some of that sex positivity. And, where, I mean, obviously, each culture is not a monolith, right? We can't say that all Muslims or all Southeast Asians, carry the sex negativity. But I would say that, definitely our history plays a big part in terms of how we view sexuality. So how their sex positivity or negativity affects them in their daily lives.
Yes, absolutely. I recommend that people, if they're interested in learning more about this like pre-colonized time of the intersection of sexuality, I recommend this book called A Taste of Honey, Sexuality and Erotology in Islam. So it sort of explores what things were like. It has like beautiful images that show, there's actually an image I came across of two women that were facing towards each other and touching, and they were smiling, right? And this is from like a long time ago. So clearly there was a lot of things that we don't really talk about now. That were very widely accepted back in the day and like even recorded as artwork.
Yeah, I mean, I think that, we do have to make a distinction. And so, just for a disclaimer sense, I do have to say that, so the author that you're referring to, Habiba Kande, has been on my podcast actually about 4 times, I would say. Uh,
Okay.
we, go over through his books and all of that, and he has fantastic books. I'm not actually sure about the reference that you have about 2 women, but, I do need to make a disclaimer that, in Islam, homosexuality is not, condoned. So
Mhm.
how people practice and things like that. I mean, I'm not going to comment on that. And this is not a religious podcast by any means. So, we can have those open discussions, but I just want to make that clear just so that people don't think that I'm, saying something that is
Mhm.
outside of what Islam says. So just to make that clarification, but, I'm not, there was a lot of definitely, I think people were probably a lot more open, but I don't know. I can't speak to that specific scenario.
Thank you for sharing that.
Yeah. So, I'd also like to know, you mentioned about discussing sex positivity, and I think that's really important. I'm curious to know about like when perimenopausal, menopausal women come to see you, what is a common complaint that they may have when they come and see you as a client?
When I work with perimenopausal and menopausal women, they're usually coming in to talk about pain that they experience, specifically around penetration. They're also coming in to talk about how they feel about their body as it changes in aging and wanting to become more connected with their body through sexuality. And then I also work with people, that can experience some impacts of menopause, such as breast pain or challenges with even libido and desire around sex. And so we do a lot of education around the changes that our body goes through over like aging and how that can impact our sexuality, and then the importance of seeing sexuality through a very flexible lens and decentering what we consider like sex looks like.
I think that's great. I think that, absolutely, we know that there are definitely lots of different forms of intimacy and ways to connect with your partner, and it doesn't always involve penetrative intercourse. So I think that's fantastic that you decenter that. But for patients that, or clients
Mhm.
rather, that, do want to participate in penetrative intercourse, and are having pain, I think it's important that we do go over a few things
Yes.
that are, definitely possible for individuals. So I would say for somebody that is having pain with intercourse, we know that as our estrogen declines in perimenopause and in menopause, that it's really important to speak with a provider that can prescribe you at least vaginal estrogen to help with that increased blood flow, increased lubrication, decrease the risk of bladder infections, and also decrease the risk of overactive bladder. And we also know that as the pH changes, it increases in perimenopause and menopause, and makes women more susceptible to vaginal infections as well. So, some
Yes.
of the treatments that women can use during perimenopause, menopause are definitely lubricants. I recommend lubricants to everyone. I think the silicone based lubricants are fantastic.
Yes.
They last a long time, and they don't leave a stain, and they, are really, it works well, and it decreases friction. But of course, that's not going to get to the root cause of the problem, which is the declining estrogen. Women also
Yeah.
use moisturizers, which we know about vaginal moisturizers. And what vaginal moisturizers will do is it'll increase the amount of water in the cells, making the tissues a little bit more plump. Typically, those moisturizers include hyaluronic acid, which helps with that. And moisturizers are fantastic. And, you can even use vaginal moisturizers in conjunction with your vaginal estrogen. So you can use vaginal estrogen. And we know that vaginal estrogen is really the gold standard for genitourinary syndrome of menopause, because it helps to increase with blood flow, helps to increase with really pumping up, making helping that tissue so that it's not paper thin anymore. It also helps with arousal and decreases pain with sex, and it will also, decrease the recurrent UTIs and prevent that overactive bladder. So really, when we have that pain with intercourse, I think it's great that you take that. I think oftentimes people have that goal centered approach to pleasure and to intercourse, right? That they think that
Yes.
anything outside of penetration is not really sex. But, I'm glad that you educate patients that there are different ways that they can experience pleasure, and it doesn't always have to be penetrative.
Yes. Yeah. Thank you for sharing. You went over different things that people could do, such as estrogen creams that they can apply vaginally. I think a big part of my work is also helping connect my clients with providers that can talk to them about potentially getting on hormone therapy in order for them to feel a little more comfortable in their bodies when they experience symptoms like this. And hormone therapy can actually hopefully relieve some of the symptoms of menopause. And I do want to talk a little bit about the role of like insurance companies in
Oh, yeah.
almost like getting in the way of specifically like women's health around these kind of things, where sometimes insurance won't cover these medications, and they're very expensive, and so it almost is this cost barrier that only some women can receive access to these things, while other women have to just endure it without, getting treatment, unfortunately.
Yeah, I agree with you 100%. In fact, in New York State, testosterone is a controlled substance, which is totally ridiculous, but it is. And so, if I need to prescribe testosterone to a patient for decreased libido, I have to actually go through a two-factor authentication to prove that it's me who's writing this prescription. You'd think that I was prescribing her narcotics or like morphine or, I don't know, codeine or something like that, but I'm actually giving her testosterone, and testosterone actually not even a lot of it, but like a tenth of the dose that we would normally prescribe a man is what we give to a woman for decreased libido. So it's not even that much. However, there is so much regulation around women's medication, right? There's
Yes.
regulation around everything. There's regulation around our bodies. I mean, it's just, don't even get me started. I mean, it's just, it's really ridiculous.
Yeah, it's very unfortunate, and I think it also sends the message that women's health care is not important, especially when it comes to sexuality.
Yeah.
And it's an erasure of sexuality as we age. We already look at people that are older through a very desexualized lens, almost like taking away their sexuality and how we portray them on media, and how our healthcare and insurance covers them. And so I think it's important to consider how society sees women's healthcare as a whole, and how that impacts us on a very individual level when it comes to pleasure.
I think you bring up a very good point, and that is the desexualization of older women. And I think that, you see that portrayed on, in news media, in movies, right, where you have older women as always the motherly figure, right? Like the grandmother, somebody who's like, really like feeble, using a cane, whatever, and you don't really you see them in a different light. And I will tell you that women really internalize these images, because I have patients come to me that are perimenopausal or menopausal, and I ask them if they are sexually active. They'll tell me, no, 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 I don't use that part of my body anymore. Or I gave that up a long time ago, as if they're giving up smoking, like it's crazy. But it's because, they've come to believe that, well, as I get into menopause, I need to become abstinent, and that part of me, because I'm no longer reproductive, right? I don't serve a function like that anymore. I can't procreate. So now it's as if like her body's useless, and she doesn't need to be sexually active anymore, because it no longer, she doesn't serve that function, so she doesn't need her sexuality anymore. And I think that that is a perception and a viewpoint that we really need to counteract. And that I always tell women that menopause does not mean that they have to become abstinent, right? That's not, the two are not equivalent. They don't one doesn't have to lead to the other. But that's what I think a lot of women are culturally, tied to, that type of view, and they internalize it, and that's what they believe.
Yeah. And I think this is also, goes hand in hand with how women conceptualize their power as they age, is in the sense of that when women age, it's seen as like their power is declining, versus when men age, they have like more power and more authority with age. And I think that also plays into how women see their bodies, their aging bodies, the way their bodies change. And they can almost, I mean, the socialized a woman in this world is, we're already fed so many messages about being undesirable unless we look a certain way, unless we have all of these things covered in terms of like having access to, a healthy diet, having access to good medication, and so on. And so it's really sad to see that as women continue to age, there's less of a focus on their sexual health, but also less of a focus on empowering them to feel comfortable in their bodies as their bodies change, and helping them connect to a gratitude of a body that is aging, and a longer life lived, because back in the day, people didn't really live such long lives. And so it really is a privilege to age. And I think our society is unfortunately sees aging as a very like phobic thing that they're all scared of. When in reality, it's very lucky that we get to live long lives.
100%. I agree with that. I mean, when you talk about people being phobic, 100%, when I talk to my patients about, if they're in menopause versus perimenopause, they'll say, no, 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 I'm not in menopause, right? Because menopause means that they've stopped having a period and they're no longer reproductive, right? So they'll be like, no, 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 I'm not in menopause. I'm in, perimenopause. And I don't even know if I'm in perimenopause, because I'm still getting periods and they're still regular. And, they discount any other symptoms that they may be having, like, say, brain fog, arrhythmias. I mean, there's a gazillion symptoms of perimenopause, right? Joint pain, dry eyes, dry mouth. I mean, name it, and women have it. But I think that there is just this thought, that you just don't want to get older because me being older means you're just not attractive anymore. You don't have your reproductive function. You don't. There's so many things, instead of viewing it as a privilege. And that's exactly what I say to people as well, that it's such a privilege to age, because we know in so many parts of the world, women don't even get that opportunity to age, right? We know with all these wars going on in the world right now, so many
Mhm.
being killed, or we hear stories of girls being burned alive. We hear stories of women being raped and all this thing, that it's really, we are so lucky to be where we are able to age and experience that getting older, because not every person, not every woman in this world has that opportunity, has that luxury to get older. So I think I agree with that 100%. And I think that it's so, sometimes I feel like, we're so ethnocentric, right? Because we are
Yes.
living in this privileged life, and we are, thank God, I mean, well, luckily, we're safe here, but we forget that there's a larger world, right? That we really
Mhm.
should also be taking care of, and, realizing how, things such as this podcast, right, are available globally. And there are people that listen to it, download it globally. And, I'm so grateful for the people that do actually have access to, say, Wi Fi, so that they can listen to
Yes.
podcasts and learn more about their health and their sexuality and whatever else that they may be trying to learn and educate themselves, because it really is a privilege to be here and to have the access that we have, because living in India, you grew up in India.
Yeah.
I did not grow up in Pakistan, but I know that when I go visit, that a lot of people do not have access to sex education. A lot of people do not
No.
realize what's happening in perimenopause, menopause. They have limited access, and even their providers do not have that information. And I'll be honest, even providers here in the US, they do not know. If you go to a regular gynecologist, that we don't get that training in sexual health. We just don't. We don't get the training in perimenopause, menopause. So really, when you find a provider that does have that information, that knowledge, I would hold on to them, because there's few and far between that have that knowledge that can actually help you out when you are going through perimenopause, menopause, and specifically if you have any type of sexual dysfunction.
Yeah, absolutely. And my hope is that as time continues, we have more providers coming into the field that have lived experiences of living in cultures where, when patients from certain cultures have identities they share with the provider, they can feel more comfortable in talking to them about it.
Yeah, yeah, absolutely. And I think that, I just, what I wish is that I wish that we could get rid of so much of the shame that we have. Not to be vulgar, right? There's a difference. I think there's a difference between being vulgar and obscene and versus actually discussing topics in a very respectful way. I feel like, all bodies deserve to be respected. And I feel that there's just there's a difference. And when you go to somebody that has that education, because they will, treat that person with respect and dignity. And I think that that's really what people are looking for. They're looking for knowledgeable providers that can give them, help them with whatever that is that they're suffering through, but also, do it in a culturally sensitive way so that they feel safe and heard and seen. And I think that, that's probably when you probably see patients yourself, right? Or clients, they probably feel that way, especially because, you're a person of color.
Yeah, it's very special for me to work with people of South Asian descent because I've had multiple clients say to me, there's so much I don't have to explain to you. There's so much that's unsaid between us that we both just understand. And I think that can be a very powerful thing when it comes to being vulnerable about something like sex.
Yeah, absolutely, 100%. And I think that, I think like all people carry a certain amount of baggage, right? And sometimes that baggage is heavier or it's lighter based on how you grew up, where you grew up, what your beliefs are, what your values are. And to unpack that every single time you go see a new provider or you go see a new clinician, right, is a lot. You're asking that person to take on the labor of having to teach you when perhaps they could have done a little bit more of the educating themselves and learned more themselves, right?
Correct. Yes.
Yeah. How do you,
Unfortunately.
yeah.
Yeah.
So, how do you help women decenter from, one type of intimacy? How do you help them to connect with different forms of intimacy in their relationship?
I like to see intimacy through the lens of creating a menu of different things that can go on it. And I like the idea of creating a menu because you can list different options. So you have an idea of the different ways of intimacy that are available to people given what kind of state they're in mentally, how their body's feeling that specific day, and so on. I do find that when it comes to especially working with women that are aging, there's a lot of education that their partners have to do for themselves because a large part of my work is also educating their partners who, if they're, if they're partners that are men, then they don't have a lot of knowledge about women's health, like at all.
Yeah.
And so they're coming in and saying, I'm feeling a little frustrated because I cannot have penetrative sex with my partner because it hurts. And so it's also about educating the people's partners about different ways to go about intimacy.
Yeah, I agree with you. And I think that, I try to encourage patients to have open communication with their partners because, typically I have in my practice, I have heterosexual couples. And so, like you said, a lot of times men do not know or do not, have not really looked into what happens to a woman's body as she gets older, as she's losing that estrogen, as that estrogen declines, what actually happens. And I think that, a lot of sexless marriages happen during this time. I think there's a lot of divorces that happen around this time because, if women are not communicating with their partners about the changes that they're having in their own bodies or how they feel about their own body, then that becomes a big barrier, right? And so they're not able to have that open communication. And their partner doesn't really know or understand. And if they're not being told by their partner what's going on, then they're just kind of left in the dark and they may start to internalize all of this and say, well, maybe she doesn't like me anymore. Maybe she's not
Yes.
attracted to me anymore. Maybe it's, and all of these other things that go on in somebody's mind
And then
instead of,
impact, yeah,
yeah,
and then impact their self-esteem, right? So the man's self-esteem is impacted, so he stops reaching out and initiating any kind of intimacy. He starts to feel bad about his body, the way he looks and presents, and then the woman starts to feel like my partner's not initiating any kind of physical touch with me. I'm unwanted. I'm undesirable, and then it's just two people existing together, unfortunately, both feeling very rejected because they don't understand the impact of hormones and our body in all of this.
Right, right. And that's why it's so important to have, well informed and knowledgeable practitioners that you can go to and ask these questions, because otherwise you're just going to think there's something wrong with you the whole time, right? And then, vice versa, you're going to think the partner and this and that. So I think for anyone that's listening out there, I think the thing that's the most important thing is to realize, one, that there are so many changes that happen to a woman's body as she goes to perimenopause, menopause. Two, if you're having pain with sex, you should not be. And so you should go and get evaluated and treated right away. And three, make sure you have that communication with your partner, right? Make sure you have that open dialogue so that they know what's going on and you know what's going on. And that can only happen when you yourself are educated.
Yes, absolutely. I also want to share a technique that is pretty common when people go to sex therapy as a couple and talk about low libido or challenges around connecting sexually. There's a technique called sensate focus therapy, where a therapist helps guide a couple in building intimacy in a very slow and intentional way. So it's broken up into different weeks. So week one, I'll tell a couple, go home, sit down beside each other, clothes fully on, and just touch each other's like non-genital zones, and focus on sensation. Don't start to expect any kind of sexual pleasure. Your goal is just to physically connect over non-genital areas. And then the next week they come back and we go another step further, and so there's it's like a very step by step process of eventually leading up to um sex being on the table, but not necessarily something that has to happen. And I've seen this technique be so powerful with people and connecting with their partners, connecting with their own bodies.
Right. Yeah. So actually, I use Sensate Focus all the. So I'm actually also a sex coach, and I use Sensate Focus a lot with my own clients. And I talk to
Mhm.
women about Sensate Focus. We also talk about. So that's Linda Weiner, right? She wrote the book, and so she was actually on this podcast earlier on in the year, and so she talked about her Sensate Focus. But I talk about patients. I talk to patients and clients about Sensate Focus because I think it's so I agree with you. I think it's very powerful. I think that also it is fantastic for somebody that has experienced trauma or abuse, or also who's never had sex before in their life. And it takes the pressure off and it allows them to go at their own pace and very stepwise. And there's no pressure in it at all from the very beginning. So there's no pressure to have an orgasm. There's no pressure to, have penetration. There's just not, there's no pressure at all. Right. And it's helping people to get into their own bodies and to focus on that texture, that pressure, that touch, using their senses, but really not too much else, in the sense that it is really right. It's to help you to get out of your head and really just focus on your senses so that you can maximize what it is that you're doing, but also it takes away the whole, I think, goal oriented approach of sex. I think it just allows people to move at their own pace. That's why I also love Lori Brado's work of Better Sex Through
Mhm.
Mindfulness. And she was on
Yes.
my podcast as well. And so she talks about, how mindfulness is so important. And she and Rosemary Basson have done all that research on mindfulness and how it helps women that have decreased libido and improves libido and lubrication and arousal. In people that have decreased libido if they use mindfulness. So I think that those, two modalities are fantastic for individuals that are suffering with low libido and, that may really find it hard to get out of their heads.
Yeah, absolutely. Another resource that I like to share with people is there are, professionals that exist that are called surrogate partners, and they're actually trained and certified to help connect with people that are currently unpartnered but want to work on being sexually comfortable or being comfortable with touch in general. And so I think it could be really powerful, for women that are going through perimenopause or menopause that are unpartnered to be able to work in collaboration with the surrogate partner and a therapist in order to have this model of care where the surrogate partner goes and works with this person on increasing intimacy, helping this person feel connected, and then both of them come into therapy together and work with the therapist on how the client is experiencing touch, intimacy, and comfort in their body, and so on. I just love that we have all of these different avenues when it comes to exploring things.
Yeah, definitely. I mean, I think that, that is a great suggestion for somebody that is not Muslim, because I think that Muslims, obviously we're not supposed to be with people outside of our own spouses and, people that we're married to. But I think that, right, for anyone, right, this podcast is open to anyone. So anyone that wants to take a listen and understand about relationships and things like that. And I think that's a great option for somebody that doesn't have, that religious belief. And so if they
Yes.
need help, kind of getting back into a relationship, or, just kind of slowly easing their way into a relationship, I think that's definitely a helpful modality to use and to have. So, yeah, I think I'm glad you brought that up. So, that can be helpful for a lot of individuals, right? Especially I think, perhaps people that have experienced like a lot of trauma,
Mhm. Yes.
and to feel worthy again. I think that, oftentimes people, perhaps if they have a lot of shame or guilt or something like that associated with the trauma that happened to them in the past, it may be helpful to them to help get back into a relationship and know that they are worthy and worthy of love and all of those other things. I think that's it's really important.
Yeah.
Yeah. So, for those individuals that may be listening that may want to work with you, how could they do that?
So people can find me at my website, which is healingwithnikita.com. I'm also available over email at my email is Nikita, that's Nikita at texgibson, TEXGIBSON.com.
All right. Awesome. Well, thank you so much. So, any last pearls that you'd want to let the viewers or the listeners know that you suggest regarding sex therapy?
Yeah, I actually have this story that came up in my head while we were talking, and it was when I just started my sex therapy training, and I was talking to my dad, and using my training as a way to, make my family a little more comfortable in talking about sex because I know that's something they never had. And I was asking him about how he experienced his sex life growing up, and he told me that unfortunately my mom had a lot of pain, and hearing that made me very sad, and just very upset that the women that came before me in my lineage may have not had access to sex that is pleasurable and makes them feel affirmed in their bodies. And so it makes me feel very grateful for the work that I do, because I feel like even though the women before me couldn't do it, that I can still have that for myself and help um, impact other people, and helping them access intimacy that is pleasurable. And I think that is very centered in activism. So I just wanted to share that.
Great. Well, thank you so much for sharing that. So, I think that's really important as well, right? Is that you're doing important work, and definitely I think we have a long way to go, right? As a society, as a culture, to bring about more sex positivity and sex positive people that can help individuals access pleasure in their relationships. So, I think that that's really important. So, thank you for all that you do. This has been real and really intimate, and we are done here. And remember, this is not meant to be any type of medical advice at all whatsoever, or any type of religious advice. And until next time, this is the Muslim Sex Podcast. Make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.